Hi, my name is Mary Beth, and I'm with the West Tennessee Women's Center, and I have LeighAnn Sutton here with me today to talk about perinatal mental health. So, LeighAnn, what is perinatal mental health?
Well, basically, mental health in itself is the way that you're dealing with everyday life stresses. And so in the perinatal period, it's really important because those are moms who are already stressed out and already have a high risk for depression and anxiety.
Why are you here to talk about perinatal mental health?
I think basically because the community does not realize how important mental health is, and especially in brand new moms and dads. And so sometimes there's a stigma associated with it that we don't talk about mental health, but moms especially have an increased risk of mental health disorders during that period of perinatal care, and also dads. And it doesn't matter if they have a history or they have no history of depression and anxiety. Those are things that most people don't realize.
Okay, what are some classic symptoms?
Well, basically, when someone is depressed, especially a mom with a new baby, it's very stressful in their life. And so they could have lack of interest in just the normal family activities. You could also feel very fatigued, or you might have high and low emotions of feeling really intense, sad, or angry, or irritable. All those things, you might even call it rage at times. And it could be directed at your partner, your husband, your significant other, and sometimes it's actually directed at your children.
So I think I've heard of this called the baby blues before. So how do you know if it's more than just the baby blues?
Right. The baby blues are really just that period of time when your hormones are not back in normal levels right after birth. And so you'll have weepiness, you'll have high emotions, low emotions, and then you have that period of time where you feel very overwhelmed, that you're not able to manage taking care of your family. Everything's out of control. You get frustrated very easily. So when those symptoms last more than 2 weeks, and you really are having difficulty functioning in just normal daily life, it could be a lot more serious than just the baby blues. And so we call that PMADS, and that stands for perinatal mood and anxiety disorders.
Okay. Is this a part of normal motherhood as far as does everyone go through it after they're pregnant?
To some degree, absolutely. Most people have the classic baby blues symptoms at some point during that perinatal period. Most parents talk about, they worry about bad things happening. They worry about not knowing how to care for their babies. As a parent, your main job is to protect your kids, and you worry that you might be putting them in harm's way if you don't know exactly what you're doing or if you're overwhelmed. So that's to be expected. But when it reaches a level of anxiety and when you're not able to control the normal around you any longer, that's when it becomes no longer a normal part of your motherhood.
And I'm going to speak a little bit about bereavement side of, you are the perinatal bereavement coordinator for
Yes.
Butterflies Embrace, which is a part of the Women's Center. And I myself am a bereaved mother and went through postpartum depression after losing my full-term baby. I remember having some of these same symptoms, and I think an important part is that people need to understand is that you don't have to go through postpartum depression if your baby dies. It can be a normal birth as well.
Yes. And that's very important when we try to do away with the stigma. And not also the stigma for moms. The stigma affects dads as well. Mm-hmm. And so when you don't have a healthy parent, especially a healthy mom, you don't have a healthy family.
That's true. So what are some symptoms of postpartum depression that are similar to PMAD?
Well, so the normal things that most mothers talk about is feeling very overwhelmed, just that feeling of, I just can't cope with this. This is more than what I'm able to handle. They either talk about having the inability to sleep or they sleep a lot more than normal. Even some moms talk about not being able to really connect and bond with their baby. And that's especially true with moms that have babies in the NICU for a long period of time. And so they're not able to have that immediate skin-to-skin interaction, which causes that feeling of not bonding with your baby. Along with that comes where you become very isolated. You withdraw from your friends and family. You just want to be alone, and that's very dangerous because that's when you need the most support. A lot of moms just say, I can't describe this. It just doesn't feel like me sometimes. But then along with that, those emotional things, the very normal physical reactions that moms talk about, which is why a lot of physicians don't recognize the symptoms of a PMAD, because they mirror the exact same things that a mom would go through after delivery: headaches, back pain, stomach distress, chest pain, feeling overwhelmed where you can't catch your breath at times. All those things are very normal in depression. But when it goes past that, and you have constant, really intrusive, harmful thoughts about you or yourself or your baby, basically when you can't care for yourself or your baby any longer, that's very serious. When you feel like there's always that shoe's going to drop, that there's something bad coming, those are very obsessive compulsive thoughts. So that's something to be aware of. Panic attacks are also very normal in a PMAD situation. And at the very greatest extreme, moms would talk about that they just feel like their family would be better off without them. So you go from the normal range of, I'm just not a good mom any longer, to I no longer can do anything right.
And there is a big stigma right now about mental health and
Exactly.
different forms of mental health. So why is it important to be aware of this?
Well, because physicians, especially OBs, don't necessarily automatically recognize the symptoms of a PMAD, they may just say, well, you'll be better in a couple of weeks and we just need to get you some rest. Well, that is true. The first thing that you need is rest. You need a good night's sleep, really good, healthy meals. But if you don't receive that support and you don't have a good support system, your medical care is going to increase. You're going to go to the ER more often. You're not going to be able to take care of your kids. And so some families even talk about that they don't have that connection with their kids, or they start thinking harmful thoughts about, their kids. For moms who are breastfeeding, they have that discontinuation of breastfeeding. And so they don't have the kids then become sicker because we feel like that breastfeeding is, a major component to good health for babies. Family dysfunction, the whole family system is affected by this. And so it's very important that moms, dads, siblings, grandparents, everyone in the family system be aware of the risk factors and the signs of a PMAD.
Yeah, I think it's important that knowing that husband, partner, person that's supporting you along with your postpartum is informed as well.
There's actually a new movement in the perinatal world where you start planning, just as you would plan for a birth plan, what would happen during delivery, you also plan for what would happen after delivery. And so you think about who's in your social network. Who can you call to take care of your kids when you're needing a nap? Who can you call for a meal to come and, have that delivered to your house? Who can walk your dogs? Who can take your kids to school? That's another part of birth planning that has that stigma associated with it, but it's very important when you're dealing with someone who's at risk for depression or anxiety.
Mm-hmm. And I'll talk about another thing that was something that I was in denial that medicine, I had to let other things help fix my problem but medicine. So what would you suggest for somebody who is afraid to go to a doctor and admit that they might be going through?
Yeah, I think that's a general consensus in the world we live in is that we want a fast fix, but we're not always ready to admit when we need extra help. And so the first step is talking about it with your family, your partner, your significant other, your husband, and your friends and family. The next step is going to the doctor and actually letting them do a thorough assessment to make sure you're not missing some of the physical symptoms that could be other things. And then third, being open to medication. Medication along with therapy. I think that's something that's a missed opportunity in the world right now, is that medication along with appropriate therapy can really help a mom deal with a PMAD situation.
The Women's Center offers training for perinatal mental health and training the nurses on the Women's Center floor and our physicians, our OB doctors, so that there is a partnership created within the hospital and our clinics so that everybody can be educated on what perinatal mental health is and the signs that we need to recognize to get the mothers the help they need. So can you talk a little bit more about that training and what's going to be involved with that?
Yes. So our goal is to make sure that every mom at the time of delivery has had a screening to make sure we know what their risk factors are. And so we want to teach our staff to make sure that they understand how to use the screening tool, how do they give that information back to the moms and dads, and then how the OB clinics are then given that information so they can make the necessary referrals to other therapists, to other clinics, manage the medicines, things like that. And so it's really important to build that bridge. And so we want to create a great community around these parents.
So thanks again for tuning in on the We Talk Health podcast, and tune in next time.